The real cause of the stiff neck. The proper treatment of stiff neck. The best exercise for stiff neck.
Firstly, let us look our normal neck movement. Cervical flexion, bending the head forward towards the chest. Cervical extension, bending the head backward with the face towards the sky. Cervical rotation, turning the head to the left or the right. Cervical side bending, tipping the head to the side or touching an ear to the shoulder of the same side. There are two main muscles that control the physiological activities of the cervical spine, the trapezius and sternocleidomastoid. Sternocleidomastoid muscle location. The sternocleidomastoid muscle SCM starts at the base of your skull and runs along both sides of Tihi neck. After the platysma, it's the most superficial neck muscle and is also one of the biggest. Sternocleidomastoid muscle function. The sternocleidomastoid muscle protects some of the deeper structures, including the carotid artery and jugular vein. It also rotates the head and allows for neck flexion. Plus, the SCM supports the head when you move it back and helps with chewing and swallowing. Trapezius muscle location. The trapezius is a thin, triangular muscle that extends across the upper back. It runs longitudinally from the occipital bone at the base of the skull to the lower thoracic vertebrae of the spine. It extends laterally to the spine of the shoulder blades and attaches to the collarbone, ribs, and L ligamentum nuchae muscle on the back of the neck. Trapezius muscle function. The trapezius trusted source helps to keep the spine straight, which promotes good posture. It supports movement and stability in the shoulder blades. It also helps with active movements, including head rotation, side bending, shrugging the shoulders, creates neck extension, allows for outward movement of the arm, helps to throw objects. There are many ligaments in the neck area. Three most important ligaments are nuchal ligaments, supraspinous ligament, and interspinous ligament. Especially the nuchal ligament, very strong and thick. The nuchal ligament extends from the external occipital protuberance on the skull and median nuchal line to the spinous process of the seventh cervical vertebra in the lower part of the neck. The trapezius and splenius capitis muscle attach to the nuchal ligament. If the ligaments over tight, then they will together with muscles restrict the neck movement. The accessory nerve is a cranial nerve that supplies the sternocleidomastoid and trapezius muscles. It is considered as the 11th of 12 pairs of cranial nerves, or simply cranial nerve 11, as part of it was formerly believed to originate in the brain. The accessory nerve consists of a cranial and a spinal root. The nucleus of the cranial root is found in the nucleus ambiguous of the medulla. It receives corticobulbar fibers from both cerebral hemispheres. These fibers then join the glossopharyngeal nerve, the vagus nerve, and the spinal accessory nerve. The spinal accessory nerve originates in the brain and enables motion in the trapezius and sternomastoid muscles in the neck. Accessory nerve injury can be caused by neck injury, trauma, or narrow vertebral artery, resulting in shoulder pain, neck stiffness, winging of the shoulder blades and weakness of shoulder, one side shoulder lower than another. Vertebral arteries supply most cranial nerves blood, and they can be interrupted by neck injury or trauma, or even a whiplash movement, resulting a stiff neck.
The treatment and exercise. The purpose of the treatment is loosen up the ligament, muscle, and make the joint move, and make the blood circulation to the brain, to the cranial nerves, especially to the number 11 accessory nerves, to get more nutrition, and make the nerves control the trapezius and the sternocleidomastoid muscle more efficient, and then they can move the head more easily. Okay, so for the treatment, we need firstly to lift up the muscle around the occipital bone and then the first atlas, the vertebra. And because around here is all the small muscles. So we use the thumb to press up, press up, press up. This can do two things. One thing to lift up the muscle. Secondly, to make the occipital and the atlas bone, occipital bone and then the atlas bone, the joints, make them move. We have more space. When the space opens, this vertebral artery here will have more open. will be more open and then give the brain more circulation. As well as that, we use the thumb to press on the first vertebra and then lift it up, and make the space between the first vertebra and then second vertebra slightly bigger. And then this will make the ankles and axis joints more movement. When these two joints move more, the arteries on the side, which is the vertebral artery, will open fully and then give the nutrition to the brain. Okay, other joints also we can press on the vertebral process and then lift up, and lift this up, and move up, and then repeat for several times. As well, we can move the side of the neck muscle and side to side and squeeze the muscle and move the muscle. Okay, so the exercise will do the same, just more movement. Okay, let's look at the exercise now. Hand on the head and cross your hands and then close to your head and then use the two thumb squeeze together to the neck muscles. Repeat for 1 minute. Okay, secondly, use your fingers, move the top muscle or both hands, you can do. Squeeze the muscle or squeeze this way. Repeat for maybe 1 minute. And then thirdly, use your the fingers press on the vertebra and lift the head, make them move. Repeat for 1 minute. Fourthly, you can rub your neck and move your head, especially the top neck. And then we can bend the neck, left, right, left, right, left, right, left, right. And then turn left, right, left, right, left, right, left, right. Also, we can cross our hands and put the head and then support the head and then move looking up. 2, 3, 4, 5, 6, 7, 8, 9,